In this video, we're going to do a deep dive into thigh lift surgery. Everything you need to know, who's a good candidate, what exactly to expect around the time of surgery and recovery. And also answering questions like, does insurance cover that? Hello, my name is Dr. Saif Gallagher. I'm a plastic and reconstructive surgeon based here in Miami, Florida. And let's get into it. So first of all, who is the ideal patient for a thigh lift? There's usually two groups of patients that come to me for this surgery. Probably the most common group of patients are folks who've lost a lot of weight and have loose skin there that rubs and causes them irritation. If there's no loose skin there, sometimes these patients can be a good candidate for liposuction instead, where we don't have to make an incision. But for a thigh lift, we're getting rid of usually extra skin. If in doubt, your surgeon will be able to recommend which one is right for you. And so that would be the first group, usually folks who've lost a lot of weight. The second group are usually folks who have a condition such as lipedema and just accumulate a lot of their weight there. With lipedema, for whatever reason, it's a pretty poorly understood condition. Folks, usually women, will acquire fatty deposits in the upper thighs, and it can be the whole leg as well, and also the arms too, especially the upper arms. And the thing about this fat is it's very resistant to weight loss and dieting. So sometimes we'll see situations where patients have really big thighs in proportion to the rest of their body because that fat just seems to grow. It's a little bit mysterious why this is caused and what exactly is going on. And usually the treatment for it is liposuction, and oftentimes with a thigh lift as well, because with that liposuction will be left behind a lot of loose skin typically. Sometimes I'll see folks who've had liposuction in the past. Liposuction of the thighs, it's in a lot of patients, it's not that satisfying because in some areas of the body, for example the flanks, you do liposuction, the skin tends to heal very nicely down to the new anatomy. This is usually not the case in the thighs. It's not very forgiving, and usually if you have extra skin there in the first place, it's really going to take a thigh lift to get rid of it. Does insurance cover this? Again, over the years, I've seen that this is less and less common, that it's going to be covered. The folks in which it is covered, if it's going to be covered, would be people who have very good benefits and who have had massive weight loss, and we can document that they're having functional problems with the extra skin down there. So what sort of functional problems? We've documented that they have trouble with their activities of daily living, clothes don't fit properly, and that a common one is they're having recurrent rashes, and this is usually needs to be documented by their primary care doctor as well. So over the course of my career, I've probably done maybe 5 of these that were covered through insurance, but it tends to be very unusual, and it's getting more and more unusual, unfortunately, which we see a lot with insurers in this day and age. So in order to get this surgery, you have to be okay with a scar. It varies a lot how patients scar after this. Some people genetically are very lucky and that scar will disappear. In general, it's a setup for a poor scar because we're pulling things really tight. So in order to get a good result and tighten up that skin, it's a necessary evil, but in general, we don't want to put a lot of tension on that scar, but we have to. There's some cool little tricks we do, like progressive tension sutures is one thing I always do in my procedures. We combine in liposuction as well in pretty much all procedures, and that treats the thigh 360 degrees. So we're not just focused on the medial or the central part where usually the loose skin is, but in a lot of patients we're contouring the outer thighs as well, giving them a more athletic appearance. And so in all of my thigh lifts, I do it through a drain-free technique, and this can really help with comfort after surgery. Pretty much everything in my practice I do with a drain-free technique. We're not just skipping the drains, we're closing down the dead space on the inside and doing what's called progressive tension scars. There's a couple of other things we do to preserve the veins down there, to preserve the nerves, to make recovery go as smoothly as possible after the surgery. But in the majority of cases, in patients who are a candidate for a thigh lift, if you have that loose skin, Loose skin means you're going to need an incision to get rid of it. There's no tightening technology. We've some new ones, but really they're not that promising. If they did work, there'd be no such thing as tummy tucks anymore, or thigh lifts or facelifts. Really, if you have extra skin, we have to get rid of it with an incision. So we'll hide the incision in the inseam, and it's not that obvious in most postures, and scar care after this surgery is going to be super important. Sometimes, depending on how much tissue the patient has, we have to extend that scar up into the groin. That's very common. Or in some patients who have deposits around the knees themselves, we may have to extend that scar down, and certainly will extend the liposuction. The medial or the inner part of the knee is very common that we'll have a deposit there that we want to get rid of to smooth out the contour and make it look as natural as possible. The surgery itself usually takes me 2 to 3 hours. It's done under general anesthetic, meaning the patient's completely asleep for it. We try to get things as numb as possible at the time of surgery, and we give good pain medicines after surgery, because surgery on the legs tends to be painful. After this surgery, the most important thing is we're going to put patients in compression, usually for 6 weeks after surgery. At first, it's going to be swollen, it's going to be bruised, and a little bit scary looking, so you have to be prepared for that. Usually the bruising goes away at about 2 weeks, but you don't see your final result, especially when we're doing a lot of liposuction, from anywhere from 3 to 6 months after surgery. It's not uncommon, because we're pulling things so tight that we may get a little bit of wound separation. There was a publication in one of the plastic surgery journals recently where they said 80% of folks will have some what we call wound dehiscence or wound separation, but that can be treated at home, usually wound care, and your surgeon will instruct you on that. We use dissolvable sutures. They're buried in there, but typically there's hundreds of sutures go into that at the time. Typically, downtime from this surgery is about 1 to 2 weeks, depending on what sort of work you do. If you can work from home, obviously you may be able to go back faster. You're up and walking around, but slowly on day 1 after surgery, going to the bathroom by yourself, but most patients are pretty slow. Usually we let patients shower about 48 hours after surgery. Like I said, I never do drains for this procedure, so that can be a big help as well in the recovery process. Typically, most folks return to strenuous activities at about 6 weeks after surgery, depending on how their healing is going. We can combine this surgery in with other procedures, which we often do sometimes in suitable candidates: tummy tucks, breast reductions, even arm lifts, if the patient is otherwise healthy and fit for it and prepared for the recovery. We're now accepting patients for this procedure, and reach out to our office in Miami. Typically, if you're coming into Miami for this procedure, we usually have you here for about a week around the time of surgery, and but a lot of our patients travel to get this done. I hope this has been helpful.